Hi, my name is Kevin Lam, and this is my presentation, Cultural Competent Care with Purnell's Model, Department of Nursing of Azusa Pacific University for Cultural Competency in Healthcare. Purnell's Model and Theory. Purnell's Model and Theory was created in 1998 as an organizing framework um, and was originally used in education in clinical practice because Larry Purnell realized that a lot of providers were not providing cultural competent care and assessing in a way that they should. So this was originally made in a clinical setting as an assessment tool for student nurses. After initial development, this has then evolved into um, a model that can be applicable for all healthcare professionals. And learning about cultural competency is not straightforward and it's a conscious endeavor because the individual has to realize that they have a bias and cultural uh, insensitivity to be able to improve, and also because culture uh, is not is not linear. Culture comes in different ways in different form, and it also increases one cultural competency that leads to improved care. So the model here, you can see that there's an outer rim, there's a second rim, a third rim, and an inner rim, and then 12 wedges and jagged lines in the bottom. So the outer rim that represents a global society, the second rim represents a community, the third rim represents a family, and the inner rim represents the person. Now, using this model to assess the person, you can look at their heritage, you can assess communication, family and organization, workforce, biocultural ecology, high-risk behaviors, nutrition, pregnancy, death rituals, spirituality, healthcare practices, and healthcare practitioners. Things that are in this black domain that represents the unknown. So some things that you don't know about their culture, things that are specifically individual, things that you just don't know that fits into this area. And jagged lines on the bottom represents a nonlinear concept of cultural consciousness. Like I said, a culture can change from one person to another. And so this model is great for assessing whether or not community and family is important to the person and is well rounded. Larry Purnell, he used to be a professor at the University of Delaware, and he created this cultural model for cultural competencies because he realized that people were ethnocentric and they were only thinking about their own culture and not the other person's culture. And so this model has, since it's so successful, it's been translated into Arabic, Czech, Flemish, Korean, German, Japanese, Persian, Portuguese, Spanish, and Turkish. And he has also written a book as well. So applications within the cultural setting. So all healthcare professionals will need similar information about cultural diversity, and therefore this model could be used to assess the patient. This model can be used to assess one's education, language, sexual orientation, social economic status, among other cultural factors. And it can be used to elicit subcultures and cultural characteristics within those cultures, because somebody that belongs to a culture does not mean that everybody from that culture has the same kind of practices. Some people can be from a similar culture but have different regional variations, and increases cultural awareness and sensitivity of the provider's actions, so that way they can assess, plan, and care in a way that is sensitive to the individual's needs. So background and history. So historically, ethnic minorities were subject to healthcare disparities, healthcare and ethnic disparities, and so and there are cultural differences among races that are important for assessments because it can change the plan of care. Healthcare providers were not assessing individuals' beliefs, values, and family, uh, community, and other factors, therefore creating a barrier to their care. So some improvements in education for cultural competency in emergencies. Um, so some things that disparities pose a threat to racial and ethnic minorities, especially in emergency situations. Emergency settings are diverse in race, ethnicity, language, proficiency, sex, and gender. Um, Systemic cultural competence training is absent from medical and nursing curriculums, even more so within the emergency setting. And emergencies highlights disparities and enhance vulnerabilities requiring greater cultural competency. Um, and so the problem is that ethnic minorities are more vulnerable in emergencies because providers are under extreme stress, and often they have less patience, respect, and empathy, and so they overlook a lot of things that are important to the individual. So emergencies response should aim to protect one's health and property, but also community resilience and cultural value. There's a high vulnerability of ethnic minorities due to financial factor, culturation level, language, migrants, background, cultural isolation, social economic status, and distress within the healthcare system. Disasters and emergency situations may further increase discrimination and racism. So during crisis, there needs to be trust between the person and the individual, such as the when nurses are assessing the individual by providing cultural competency, they can build the trust of that person and therefore gather more information that's relevant for their healthcare. Emergency disparities and how can Purnell's model be used to address these areas. So Purnell's model can be used between healthcare, discipline, and environment, making an ideal model for all providers to assess and transfer information. Um, One major assumption of the model states that all professionals require similar information in order to provide culture competent care. Another model assumption that culture competence reduces prejudice and bias through cultural understanding, and the model assess not only an individual but the society and family as well. Individual domains that may be used to assess patient include heritage, communication, spirituality, healthcare practices, all of which are overlooked in emergency. So, for instance, for the nurse that is assessing and treating the um, ethnic minority, using this model, and those 12 wedges mentioned earlier, they can really dive into what is important for the individual. Recommendations for change. You can incorporate cultural competency and professional standards as a baseline to build upon during emergency situations. Incorporate online culture competency program into the nursing curriculum. Um, Teach culture competency during nursing residencies, and provide longer courses with active participation, discussion, presentations, and simulations of emergency situations where you will need to assess for the individual's values, beliefs, and preferences. And so, last but not least, incorporate Purnell's model of cultural competency and theories into the course curriculum and use this to apply this in the emergency setting when you are treating and assessing minority individuals. Two areas of two cultures that we'll be looking at today is cultural characteristics of Hispanics and Asians, and to how to use Purnell's models to provide culture competent care for these individuals. So Latinos are not a monolith. So what that means is that Latinos, there are many different cultures that fall under Latinos. For instance, there's Mexicans, there's El Salvadorians, and Peruvians. First generation Hispanics use high fats such as lard, milk, and cream in their food as part of their diets. Immigrants are more likely to retain their native cultural beliefs and ideas regarding the um, health and healthcare, and folklore is often a first choice for these for Hispanics. And so what that means is that as individuals that's been here, second and third generation is born in America, they are less likely to maintain their cultural beliefs. But if you know that somebody has come over as an immigrant, they're more likely to keep their traditional beliefs. So using Purnell, you can assess for how deep of a cultural um, to assess how they are likely to keep their cultural beliefs, and that way you can find out how you can incorporate your care and their cultural beliefs at the same time. Asians are also not a monolith. So, for instance, there's Chinese, Japanese, Koreans. Cultural perception influence patient care decisions. For Asians, they're not typically categorized as people of color, an underrepresented minority due to their success. They are more likely to be categorized with whites, and so therefore that is a disparity for them because they think that they are healthier than and have less risk than they really do. In contrast to Western patient care models, many Asian cultures prefer family-centered care and family-centered model of healthcare, and they believe in a hot and cold theory where you have to balance things out. History of these two different ethnicities within the United States. So Latinos, traditionally, they have less access to healthcare services compared to Asians and whites. Latino immigrants are less likely to seek primary care, health care services, and screening medication, prescription, and visiting the emergency department. Asian Americans have a high exposure to environmental carcinogens, so cancer is the leading cause and death in Asian Americans, and Asians have lower cancer screening compared to other groups. Communication styles. Hispanics, many of them like to start off with small talk before they get into intimate conversations. Address formally with indirect contact is a sign of respect. For Asians, the use of feeling to guide behaviors, indirect silence, and inferred meaning. They also use different linguistic codes based on sex, age, and status and intimacy. And so for the Asian group, a silence sometimes may also be a form of communication for them. Social organizations. Hispanics value communication, nuclear and extended family. Mothers and fathers often have gender roles. For instance, fathers provide for the family and make the decisions while the mothers stay at home and take care of the children. For Asians, there is a high respect for their parents and elders. They have shared decision makings, typically in large groups, specifically with Chinese and Japanese families. They are the decision is assigned to the eldest son. Their perception of time. For Hispanics, they're usually more flexible and relaxed with a sense of time compared to Western culture. They are more focused on the present because they see the future as more in God's hands. For Asians, they tend to be more past oriented. Information in the past are seen as more relevant to making future problems, and therefore they value the past more than the present. Biological risk. For Hispanic, the leading cause of death is cancer, heart disease, and injuries. A high risk factor for They also have a high risk factor for diabetes and liver cirrhosis. For Asians, they also have a high risk for cancer, heart disease, stroke, and accidents. And they have a higher risk for COPD, hepatitis B, and liver disease. So using Purnell's model to provide cultural congruence for these two different populations, Purnell's model allows for continuous learning of different cultures within a various setting while decreasing bias by understanding their unique culture and applying the findings to develop cultural competent care. Using Purnell's model for all patient interaction help address primary and secondary characteristics of one's culture. How to use Purnell's model um, to, to uh, to promote how to use Purnell's model for cultural sensitivity for Hispanics. So understand that Hispanics are not a monolith, so assess about their culture and find out what specific culture they belong to. Determine if faith and spirituality is important, and if it is, incorporate that into their care. Determine the importance of family members within their care. For instance, if a father figure is around, you might think in the back of your head that they are the decision makers, so therefore you want to include them in as well. Determine biological factors that are relevant and specific to the individual. Address diet and culture specific dishes that are staples to them. For instance, using oil, lard, might be something that's important to them. So you want to find out ways you can decrease that while remaining culturally sensitive. Assess one's healthcare practices and inquire about folklore and alternative medicine because a lot of times they do turn to folklore medicine before they turn to Western medicine. Using Purnell's models for cultural sensitivity in Asians. So understand that Asians are also not a monolith, and so determine what kind of culture they are, their cultural background is, if they're Chinese, if they're Japanese, if they're Korean. Determine what cultural ethnicity Because after you determine a cultural ethnicity, provide them with language interpretation services, um, address the patients and their family as they tend to have shared decision making, um, deter- determine what their cancer risk is and educate them about cancer screening, um, address diets and cultural specific dishes that are staples to them, and inquire about the use of alternative medicine and herbal remedies. So all these are different things that you might want to think about in assessing these two different cultures, and more so, how would you, and more so, you want to also think about these things during emergency situations as a nurse and provider when you are gathering information about these individuals. These are my references, and thank you very much for paying attention to my presentation.